Hello, I am Dr.Deepti Challa. Welcome to IRACON 2023 Hyderabad. Today, we have with us an eminent rheumatologist, Dr. Sarang Chitale. He is the consultant at Wrightington Hospital, and he's also a member of the BSR MSK Ultrasound Core Committee. And he also has designated the Wrightington Hospital as a ULAR training center for musculoskeletal ultrasound. Welcome to IRACON, Dr. Chitale.
Thank you. Thank you, Deepti, and thank you, the organizers.
So, Dr. Chitale, this is your first time in Hyderabad. So, how are you finding Hyderabad?
Yes, this is my first time, and I didn't know what to expect, and it has superseded my expectations. Hyderabad is a very interesting city. It has a lot of history, like the Charminar, Golconda Fort, and it is the future of India as well. It has got all the IT sector, the financial sector, and I really enjoyed being in Hyderabad.
Thank you. So, how are you finding the IRACON 2023, especially with regards to its scientific program?
It's very enjoyable. The scientific program is very well designed, and it has got the clinical aspects, the basic aspects well catered for. The Anvaya Convention Center is very good, very futuristic. We probably look at similar centers across Europe or UK. This is probably better, I would say.
So, Dr. Chitale, as your special interest is in ultrasound, I would like to ask you, you use ultrasound on a regular basis for diagnostics. So, how do you feel ultrasound would help as in diagnosing and managing a rheumatological condition?
Ultrasound is now becoming or has become a stethoscope of the rheumatologist. It's very, very useful and an integral part of clinical assessment of the patients at various time points in their journey, at diagnosis, looking at remission assessment, looking at escalating treatment or de-escalating treatment. It has got a significant added value, and it is easy to perform once you have got the training, and it is readily available, unlike other imaging modalities like MRI scan.
So, in the past 5 years, considering rheumatology and its management have been relatively newer compared to the other fields of medicine, where do you find rheumatology 5 years from now?
I think rheumatology is one of the pioneering branches of medicine. We have led other branches in the use of biologic therapies, in the use of treat to target. Again, ultrasound really helps treating to target. Like today, we had a talk from Dr. Rath about psoriatic arthritis in ultrasound, and you can see that if ultrasound is used in clinical trials, we can target different aspects of psoriatic arthritis like enthesitis, dactylitis. So I think the future is targeted therapy, not only targeted to the patient, but targeted to the joint, to the system, and ultrasound will really lead on that.
You're also one of the consultants of the MED rheumatology program. Can you please elaborate more about that?
About 5 years ago, we started a Master's of Medicine in Rheumatology, and there are few of rheumatology consultants in the UK who are doing that. We started it because we wanted to give something back to the Indian rheumatology community, and we have had a few successful masters in rheumatology training, one of which is obviously you, and you're coming back and practicing here. So it shows the strength of the program. The program is going from strength to strength, and we are adding on new centers that actually train these doctors. And it is always nice to see that our trainees are doing so well back in their home country.
I truly have to agree with that because whatever I am is MED rheumatology has significantly helped a lot. So to conclude, Dr. Chitale, you also trained in India, and then you've also trained in the UK, and you're now working in UK. So can you please tell me what similarities and what differences you find between the two sets of healthcare systems?
So I've done my undergraduate training in India and postgraduate training in the UK. Both in India and UK, we put a lot of emphasis on education and getting the knowledge. The difference, I would say, is in UK, we practice evidence-based medicine. If the evidence is not there, we do not do X, Y, and Z thing. In India, that may be slightly different, but it is now building up towards practicing evidence-based medicine. Also, because the UK is a socialist system, National Health Service, patients don't have to pay for it. However, that means that there are waiting lists build up. So patients can wait up to 4 months, 6 months to see a rheumatologist. Whereas in India, they not only see one, but they see 2, 3 rheumatologists within a matter of few days.
So, do you have any words for upcoming rheumatologists for the future?
I think rheumatology is one of the great branches of medicine. It has got a potential for clinical work as well as research. What I like about rheumatology, it is fully based on your clinical diagnostic skills. The tests are only supplementary or complementary. I really like that about rheumatology, and it is at the cutting edge of all the medical specialties.
Thank you so much, Dr. Chitale. Thank you for this interview.
Thank you.
And thank you, IRACON-TV.